Hello, my name is Maggie Curran, and in this video, I will be discussing the potential benefits of omega-3 fatty acid supplementation on cardiovascular health. I will begin with a breakdown of omega-3 fatty acids. Omega-3 fatty acids are a group of polyunsaturated fatty acids that are important for a number of functions in the body, such as decreasing inflammation, lowering blood pressure, and stabilizing heart rhythms. There are three main types: EPA, DHA, and ALA. These are essential fatty acids and must be provided through one's diet or supplementation. As seen in this image, EPA and DHA fatty acids' main food groups are salmon, mackerel, cod, and other fish and oils. APA fatty acids consist mainly of nuts and seeds. In this video, I will focus on the effects omega-3 fatty acid supplementation has on one's cardiovascular health and how it has the potential to decrease the risk of heart disease. Omega-3 fatty acids have many benefits regarding heart health. One of its main mechanisms is its ability to lower triglyceride levels. Triglycerides are a type of fat that help with blood circulation. It is important to have some triglycerides in the body. However, high levels of triglyceride tend to lead to heart issues as the body cannot circulate blood properly. Another benefit of omega-3 fatty acid supplementation is reduced inflammation, which is another one of the main contributors to cardiovascular disease. Inflammation is the root for many heart diseases and other negative health factors, so it is important to keep these levels fairly low, and omega-3 fatty acids work to reduce these levels. As seen in this image, nuts, oils, and fatty fish are all foods that decrease inflammation, and they are also all foods with high levels of omega-3s. Overall, evidence suggests consumption of omega-3 fatty acids is beneficial for cardiovascular health and can help people with a history of cardiovascular disease. Cardiovascular disease refers to a group of disorders which have great effects on the heart and blood vessels. These conditions range from diseases affecting the heart muscle, such as heart failure, to diseases in the blood vessels, such as hypertension. Cardiovascular death is the leading cause of death worldwide, with almost 18 million global deaths, so it is important to maintain a heart-healthy lifestyle. There are a few modifiable and non-modifiable risks for cardiovascular disease. The non-modifiable ones are age, gender, and family history. These factors cannot be changed. However, the modifiable risk factors like smoking, physical activity, and poor diet can improve one's heart health and decrease the risk of cardiovascular disease. I will now go through three studies regarding the effects of omega-3 fatty acids on people's cardiovascular health. In the study done by Q Zhang and others from the Nutrition, Metabolism, and Cardiovascular Disease Journal, titled Effects of Fish Oil-Derived Fatty Acids on Suboptimal Cardiovascular Health, their central goal was to determine the potential benefits of fatty acids in participants with suboptimal cardiovascular health. Suboptimal cardiovascular health is interpreted as having both suboptimal health and metabolic disorders. This study was a randomized, double-blind, placebo-controlled trial, which meant that the participants were placed into two separate randomized groups, where one group was given 2 capsules of fish oil, also known as omega-3 fatty acids, supplementation, and the other was given a placebo pill. These supplementations look and taste the same, so both groups are unaware of what pill they are given. There were a total of 422 participants separated into two groups of 211 in this study, and they all had suboptimal cardiovascular health. They determined these participants by using a suboptimal health questionnaire, and whoever scored above a 35 was considered to have suboptimal health. The researchers hope that the numbers will go below 35 after supplementation of omega-3 fatty acids. This study took place over the course of 3 months, and by the end, a total of 51 participants in the fish oil supplementations group transitioned into the optimal health status, and 10 participants transitioned into optimal cardiovascular health status. Both of these numbers were significantly higher than the amount of participants who had received the placebo pill. Overall, the participants who took the omega-3 supplements had decreased BMI and improved suboptimal health. Some of these possible explanations for this study are that the intake of omega-3 LCPUSA FA enhances immune and digestive functioning by modulating oxidative stress and improving insulin resistance, as quoted by Q Zhang. These are factors that help improve cardiovascular health and improve one's well being overall. This study relates to my research question because it proves that omega 3 fatty acid supplementation can have positive effects in regard to improving cardiovascular health and can help to reduce some of the risk factors that are linked to poor cardiovascular health. The next study I used was from the American Journal of Clinical Nutrition and is titled Omega 3 Fatty Acids and Cardiovascular Disease Risks Among the Inuit of Nunavik. This is an example of a cohort study where they tested 426 Inuit on the relation between their omega 3 fatty acid intake and cardiovascular health. The traditional Inuit diet is very rich in omega 3 fatty acids since they live in an area where it is very easy to obtain fish and it is one of their main meals. These participants all participated in a health survey, which included home interviews and clinical visits. The researchers were using these surveys to determine their levels of EPA and DHA, which are the main components of omega 3 fatty acids and have a strong correlation towards good heart health. The results from this study show positive effects on omega 3 fatty acid consumption and cardiovascular health. It found that higher levels of omega 3 fatty acids were associated with lower levels of triglycerides, total cholesterol, and LDL cholesterol. All of these are beneficial components of cardiovascular disease, and these findings suggest that omega 3 fatty acids have a protective effect regarding cardiovascular health and maintaining a healthy lifestyle. Overall, these results support my research question by proving the positive effects that omega 3 fatty acids have on your heart health. However, it is highly unlikely that everyone will be able to have the same diet as the Inuit population. So these results are less beneficial to those with difficult access to fish high in omega 3s and may have to opt for an over the counter supplementation to assist in their heart health. The final study I found was from the American Heart Association and was conducted by the Honolulu Heart Program. The title of this study is Fish Intake May Limit the Increase in Risk of Coronary Heart Disease, Morbidity, and Mortality Among Heavy Smokers. Smoking is one of the main contributors to having poor heart health and increases one's risk of cardiovascular disease. Many fish are very high in omega 3 fatty acids, and since our body cannot produce omega 3s themselves, it is important to incorporate them into one's diet. The central goal of this study is to see if fish consumption will limit the damage done to the lungs by smoking. This is a longitudinal study that is studying the same group of people over the long period of time. The Honolulu Heart Program gathered 8,006 men of Japanese ancestry between the ages of 45 and 68. They studied them between 1965 to 1968 for the development of coronary heart disease and stroke in regards to fish intake, if they had it less than 2 times a week or more than 2 times a week, and smoking status, never, past, and current. It was shown that incident rates in current smokers participants who had low fish intake increased based on the number of cigarettes smoked per day. They also found the results are similar regarding fish intake and coronary heart mortality rates. It was found that subjects who had a high fish intake smoked more cigarettes per day, lived more years in Japan, consumed more calories and alcohol per day, were more physically active, and had higher serum uric levels than subjects who had low fish intake. This study supports my research question by showing the positive effects that omega 3 fatty acids have on decreasing cardiovascular incidence and mortality rates in people who heavily smoke, which is a main risk for cardiovascular disease. However, this does not mean that omega 3 fatty acid supplementation will completely void the negative effects of smoking. It is still suggested that the best way to maintain a healthy heart is to quit smoking altogether. In conclusion, incorporating omega 3 fatty acids into one's diet can have a significant impact on preventing cardiovascular disease. Their anti-inflammatory properties, ability to reduce triglyceride levels, and positive effect on blood pressure and blood vessel function contribute to overall heart health. By including sources of omega 3 fatty acids such as fatty fish, flax seeds, and walnuts, individuals can promote a healthy cardiovascular system and reduce their risk of heart disease.